I've wanted to be a physician since I was a little kid. You could ask my parents. I told people when I was a little kid that I wanted to be a pediatric neurosurgeon, and then through the course of my training, sort of refined that a little bit. Then I was fortunate enough to get into medical school. I went to Emory University in Atlanta. I loved my time at Emory. I went there for undergrad as well, and then hung around for a master's in public health during the course of my medical school. Public health is a fascinating aspect of taking care of patients. You don't meet a whole lot of surgeons who also have public health degrees, but to me, they go hand in hand. And then when I finished medical school, I went and did my general surgery residency at the Mayo Clinic in Jacksonville, Florida. I was there for 5 years. That's where I met my husband and where our oldest son was born. And then we moved up to Philadelphia. I did my fellowship at the Bryn Mawr Hospital just outside of Philadelphia, and then we came here. I chose to come to UT Medical Center because it felt like a perfect fit for me. I knew that I wanted to be in the Southeast. We have family who live nearby. I love taking care of women from this region. And then the staff that I get to work with, there's something very special about the UT Medical Center that I didn't recognize until I got here and started interviewing and started interacting with folk, that there is a palpable, I call it a volunteer spirit here, that people just want to help each other out. It really, we all work together to take care of the patient. And that was very much how I was trained. And so it felt very comfortable. I felt like I was at home here. And since being here, I have not been disappointed. It seems like the people who are here really want to be here and want what's best for our patients. It seems like the people who are here really want to be here and want what's best for our patients. You would want to bring a family member here, you would want to bring a loved one here, because you're going to get state-of-the-art care in a multidisciplinary environment with a caring, genuine heart for what's best for the patient. A lot of times when I see a brand new patient, they are scared to death of their disease, and they can't even see straight because their mind is just rattling with that C word, that cancer word. You know, one of the things I love about breast cancer is that there's so much hope in this disease. There's a lot of research going into it. There are a lot of treatment options that are available, and the outcomes for breast cancer are really outstanding. For all comers, there's a 90% overall survival at 5 years with treatment. So patients the vast majority of patients do very, very well with a breast cancer diagnosis. And I love working in an area where there's a lot of hope. As a woman, I can relate to other women who are going through it and sort of the complex nature of their diagnosis, because this isn't the same as a diagnosis of colon cancer or melanoma. There's something unique about breast cancer. And so I feel like I can relate to women on that level. My mom was diagnosed with breast cancer about 2.5 years ago. 3 weeks after I started working here, she was diagnosed with breast cancer. So not only have I sat in the position of a provider, but I've also sat in the position of a family member and journeyed along with my mom from a non-provider standpoint as a support and as a loved one walking through it. And I think that really has shaped the way that I take care of my patients, because it's not until you walk through the journey, either as a patient yourself or as a loved one of a patient, it's not until you walk through that journey that you really realize what the patient is going through. And I think that has increased my compassion and my empathy towards patients, and also empowered me to continue to provide hope to the patients. Because every time I see my mom, she's a reminder that breast cancer is a treatable, curable disease. And I hope that when patients leave the initial consultation, that they're empowered by knowledge of their disease and a plan of how we're going to take care of it, and also feel loved and well cared for. I have 2 sons who are 4 years old and 17 months old. So I'm a busy mom, a busy physician, busy wife. But my boys definitely keep me on my toes. And I love spending time with them. And I also love being here. So I feel like I have a great blend